Hi, my name is Jim Duren. I'm the EMS Director for the City and County of San Francisco. In today's lecture, we're going to talk about the efficiencies in pre-hospital STEMI recognition and care. Before implementing any new program, always refer to your local policies, procedures, and medical direction. I do not have anything to disclose. I'm not working for any company, corporation, or endorsing any products. So let's get started. Data science plus technology and training equals patient outcome. Or better yet, patient outcome is a product of a commitment to data science, technology, and training. Our learning objectives today are to be able to understand the why behind efficient EMS STEMI care, best practices in the care to reduce on-scene time, and a knowledge of 4 top STEMI injury patterns. So let's get into this. Why we do what we do. Heart disease is the #1 killer of Americans today. Along with that, there is an economic impact of the patients that survive myocardial issues. Along with the economic impact, there's a quality of life due to their disease process. So our goal is, one, to reduce death and to reduce the economic impact and to increase the quality of life. Our goal is to have the total time from first medical contact to reperfusion should be less than 90 minutes. First medical contact is defined as the time the first person arrives at patient's side. It could be an EMT, could be a paramedic, but that's when the clock starts ticking. We would like to have a patient reperfused within 90 minutes. In San Francisco, we have a goal of 60 minutes. Yes, it is a stretch goal, but we feel that if we can get somebody reperfused faster, there's less damage done to their heart, which then decreases the economic impact and it increases their patient's quality of life. So let's talk about ways that we can increase efficiency and moving the patient through the system as efficiently and expeditiously as we possibly can. One of the things that we have to understand is when a person experiences chest pain, how long do they wait before they call 911? So that's a good data point to use in your system. If you find that it's a very long time, you might want to look at ways of doing targeted education to those areas in your community. And what does the targeted information say? Well, it could be signs and symptoms of chest pain, myocardial issues, and when to call, and how to self-treat. The next thing what we want to do is when they do call 911, do the dispatchers have the appropriate algorithm and questions to ask to make sure that the patient is having a myocardial infarction and to be able to dispatch the appropriate units? They can also give pre-arrival instructions as the use of aspirin. The next thing we want to look at is what happens when people arrive on the scene, our responders. What we have to do is proper documentation. What we need to document is our data points that we can use as far as collecting data for future use. And we want to make sure we document the patient assessment, onset of symptoms, and the duration of symptoms. We should do blood pressures on both arms. This is an easy thing to do to differentiate between a myocardial infarction or a potential thoracic aneurysm. A decrease in blood pressure from one arm to another of 15 points or greater could maybe signify that a patient could be experiencing a thoracic aneurysm versus a cardiac event. Oxygen saturation should be done at room air. Supplemental oxygen should be administered if the person's oxygen saturation is below 95%. Our goal is to get them in the 95 to 99% oxygen saturation with supplemental oxygen, or not, if they're already in that zone. The next thing we want to do is a 12 lead. That's going to give us a best idea of what's going on with the patient. One of the things that studies have shown that you can increase the quality of your transmission or acquisition of the 12 lead by doing skin prep. Skin prep is just as simple as wiping down the area that you're going to apply the patches prior to applying the patches, getting all the oil and dead skin cells off, and then applying the patch to a clean area. That can actually increase your quality of tracing, because what we want to do is have the best tracing possible that we can transmit to the hospital. Correct 12 lead placement is very important. Don't take shortcuts. Make sure you measure out where the right location is and apply the right patch to the right location. After acquiring the 12 lead, you have to make a differentiation between, is this a STEMI or a non-STEMI patient? We have to really think about the four major injury patterns that we want to notify the hospitals of as quickly as we can. And these people have the highest incidences of going to the cath lab. So the earlier notification that we can give to the hospital, the better. We'll talk about what those injury patterns are in a few minutes. The next thing you want to do is transmit your 12 lead to the emergency department that you're going to, and then always follow it up with a phone call, because we know that sometimes the emergency departments get busy and they don't check their fax machine, or they don't check their other ways of receiving the 12 lead. And sometimes a quick phone call is just a reminder, hey, we have this STEMI patient, did you get the 12 lead? Then you want to go ahead and start your treatment. One thing that is always good is that an IV, 2 IVs in place is ideal. Aspirin early on, nitroglycerin as needed, pain medications, fluid challenge, if warranted. The other thing to think about is that a high incidence of patients that are experiencing myocardial infarction actually arrest en route to the hospital. Knowing this, a thing to do is to apply defibrillator patches on the patient, anticipating that if this patient arrests, all you would have to do is charge and defibrillate. This is a team approach. One of the things that you want to do is pre-identify the positions prior to the call. So as you're going to the call, start with your partner, or if you're in an engine company, and really pre-identify who's going to do the blood pressure, who's going to do the charting, who's going to do oxygen saturation. All of this is really, really important to help minimize on-scene time. And then a really important thing is always think about what is the next level of care that you're going to, and think about what can I do on the scene or while the time I'm with the patient to help the person or the department that's going to receive the patient. If you know that the first thing they do when you come into the hospital, they put a patient in a gown. Could be putting the patient in a gown before they get there. Or if they start a second IV, then maybe we can start a second IV to minimize the time in the emergency department. And once you work on this plan and you start developing data points, you want to utilize these data points and figure out how can we shave off time? How long did it take us from first medical contact to aspirin administration, first medical contact to IV, first medical contact to 12 lead. These are all the data points that we can sit there and analyze later and say, how can we speed things up? How do we build efficiency? And then train for that. And then implement those procedures and then try to increase your efficiency. These are the one things that the 4 top injury patterns that we really want to look at. We're looking at a lateral, inferior, and septal and anterior myocardial infarctions. So these are the 4, as you can see, this is, the limb leads and the chest leads. And it kind of gives you an idea of where those injury patterns are. And the other thing to think about is, if you know where the injury is, and if you know what vessel it is, and you know what that vessel supplies blood and oxygen to, then you can almost anticipate what might happen to the patient. And then there's no surprises. Always try to stay 2 steps ahead of the patient. Again, the 4 injury patterns: lateral, inferior, septal, and anterior, or LISA. When looking at a 12 lead, know where to look for it, anticipate, and then stay a couple of steps ahead of the patient at all times so there are no surprises. I'll leave you with one quote: "A system that measures, analyzes, and trains will improve." This will help your patients tremendously. It will decrease economic impact and increase a patient's quality of life. Thank you very much.